when your client is in crisis, it can cause some a bit of anxiety because you need to make sure that somebody living in the community is safe. Hello, welcome to the Chronicles of an African Diaspora Nurse. Thank you so much for tuning in. Today I'm doing a video on my role as a community psychiatric nurse because I'm getting feedback from some people, and I've had messages asking me what is the job of a community psychiatric nurse. So a community psychiatric nurse is someone who's been trained in mental health nursing, and most of the time they've worked on the wards, inpatient wards, and then moved on to work in the community. But I need to also say that these days sometimes people come straight from school, straight from qualifying into a community team. So a community team is based in the community, which is made up of multidisciplinary team. We have psychiatrists, we have doctors, we have occupational therapists, we have social workers, we have therapists, we've got psychologists, we have employment support specialists. So the team that I work in is a specialist team, and it's called the Early Intervention in Psychosis team, which means we look after people who are experiencing psychosis for the very first time. When I say psychosis for the very first time, so they haven't had any contact with mental health services. So the rationale is that when people are identified early, then when we deliver the package of care, they are more likely to recover. And so the package of care that we deliver as an early intervention team is that we offer psychological input where people are given CBT in psychosis or cognitive behavior therapy in psychosis to manage their symptoms. We also offer family intervention work where we work with clients, families, have sessions with the family. We have psychoeducation to educate the carers of families so that they'll be able to better support their relatives who is experiencing mental illness. Then we also offer employment support. Some people may be in employment and they've had to come off work, and so there are issues with occupational health where we support them in terms of getting time off, or even providing sick notes, giving them support letters and evidence to show to their employers that they are under a mental health team, that they need support. And equally, when people are in education or in universities or wherever they are learning, we liaise with the institute, and most of these educational institutes have support units attached where they provide support from any student who is experiencing a mental health issue. So they liaise with these support departments to support the student. So we have that employment support or support with education. Then also we help people with finances, whether people are in debt, we can refer them to somewhere where they can manage their debt, or maybe even to write it off, or have reasonable repayment plans for them. Then also when people need benefits or they don't know where they can get this, or advice on getting the right benefits, we have somebody, welfare and benefits advisor, that we refer them to so that they'll be able to support them to receive the right benefits. And sometimes people come off benefits and gradually get supported to get back into work because they gain more self-esteem in terms of doing something to earn some money. For some people, they rather go back to work than receiving benefits, so we help with them as well. And then of course we do medication management, so we monitor their medication in the community. Some of them get their medication from their GPs, others too medication are prescribed by the team. So we manage it, monitor it in terms of side effects, whether it's working or it's not working. Do we have to arrange medical reviews to review these medications and change it, or adjust the dose, and all that. I mean, the nurses will understand medication review, so we do all that as well as with the package of care. And then we also have an exercise component where we refer people for exercise therapy. So they'll get a personal trainer, and we call it the active well-being service, where they will meet up with one-on-one with somebody, take them out, assess them at the level at which they can exercise, what is good for them. They will go according to the client's pace, and take them to the gym or to the park or to the local recreational centers. And it's a very good intervention, as we all know that exercise does boosts the mood. So every client who's been on this exercise program comes back with positive feedback that it's helped them. Yeah, so we have that as well. We have the exercise program. And then we also support with housing. When people don't have housing, they are homeless, we help them to apply to get a place to live, and most of the time it will be temporary accommodation or maybe within shared accommodation, and then eventually they can go on to get their own flat. And there may be some people facing issues with eviction, either because of rent arrears or whatever the issue is. We support them to come out of that as well. So as you can see, all these things, support with housing, support with finances, support with education, support with exercise, support with psychological input, all these things come together in a holistic way to aid in the client's recovery, because as you and I know, all these things that I've mentioned, if you have problems with that, I mean, it will definitely have an effect on your mental health. And not to talk of somebody who is already experiencing mental health issues and having problems in all these areas that I've mentioned. We also recognize the need for pastoral care, so we support people in terms of referral to either a pastor, a priest, or an imam, depending on their faith, because the spiritual aspect of care is very important as well. And we recognize that for some people it plays a very important role in their recovery, so there is also that support available. Yeah, so in short, this is the work that I do, and what it entails is that each person who works in a team or in my team has a caseload. And when I talk of caseload, it means that you are given a number of people that you look after in the community. So you need to prioritize your time and prioritize how often you are going to see people in the community depending upon their risks. When it comes to how and where we meet clients, there are different ways that we meet up with clients to have a check-in with them. So one way is going into their home, doing home visits. Of course, you need to do your risk assessment and make sure that it's safe to go into somebody's home. So we do that. And then we also have appointments at the outpatient clinic, at the hospital base, where we have consulting rooms. So we would book a room and see people there. The other alternative is that we can meet in the community, and it could be in the park or a local cafe where you have a cup of tea or a cup of coffee and have a check-in with clients and make it as as relaxed as possible. And as I said, we can also meet in a park whilst having a walk and having a chat. So we do all that to ensure that we are monitoring people and also providing the care and coordinating their care. And this is why we also have the title care coordinator. So a community psychiatric nurse can also be referred to as a care coordinator. Some people you might have to see every week, some you might have to see every 2 weeks, and some once a month, depending on the risk. Okay, so we operate a zoning system. People who are in red are seen frequently, people who are in amber are seen, 2 weekly, and people who are in green, stable, are seen monthly. And it can happen that somebody will be in green zone being seen monthly, and then they can, quickly come back to red zone because of a crisis or something. Then you need to have to see them as often as you can. And also, it's important to know that it's a multidisciplinary team, which I've mentioned before. But in addition to that, we also work with other agencies. We work with social services. We work with the police. We work with the probation service. We work with housing. We liaise with the legal system, the prisons. So there's a lot of liaising that goes on that we do, all in the aim of providing holistic care for clients. So yes, in short, this is what a community psychiatric nurse does, and this is what I do. I work in a specialist team. There are other teams in the communities who specialize in particular areas of mental health, but as I said, I work in the early intervention in psychosis team, and I love working in this team because we have the resources, we have the personnel. If you need to refer somebody to a psychologist, it's easy, they are there. If you need to refer to employment specialists, they are there. If you need to refer to a debt advisor, they are there, they're accessible. If you need to refer to a welfare and benefits advisor, they are also accessible. And it makes the whole work easy and enjoyable, even though it can be the downside. I wouldn't even say the downside. When your client is in crisis, it can cause some a bit of anxiety because you need to make sure that somebody living in the community is safe, is safe. The risk to themselves and to others is very managed in the community. So yeah, that's the work I do. If you have any questions or anything you want to know about the work of a community psychiatric nurse, let me know in the comments below and I will answer you. And if you like this video, kindly subscribe for more. Till I see you in the next one, take care and bye.